I'm Monica Robbins with your top 3 health headlines today. If you haven't had your seasonal vaccines, now is the time to give it some serious consideration, especially before you see your vulnerable relatives next week or over the December holidays. Here's the reason why. We had a tough influenza season last year, and this year could be a repeat. The reason is partly due to lagging vaccination rates, but also due to a new mutated strain. This one is called subclade K, and it's behind early surges in the United Kingdom, Canada, and Japan. And we all know it's just a plane or a car ride away from the U.S. if it's not already here. Last winter, the U.S. had its highest rates of flu hospitalizations in nearly 15 years, and at least 280 children died of influenza. That's the highest number on record going back to 2004. So please talk to your pharmacist or healthcare provider about your options. And yes, the current flu shot does provide protection against this new strain floating around. And speaking of cold and flu season, many of us will be dealing with those miserable symptoms: coughing, sneezing, and sore throats. Cleveland Clinic doctors say it takes about 10 days to get over a sore throat, but there are several things you can do to ease the discomfort. Try gargling warm water with a little bit of salt or honey in it. Try drinking warm milk or tea, but avoid caffeinated beverages, even coffee, because it actually dries out your throat. And sorry guys, same goes for alcohol. Consider a humidifier to keep moisture in the air, and if your pain lasts more than 10 days, seek medical attention. And of course, you can try remedies at the pharmacy, but according to GoodRx, nearly 50 million Americans lack adequate access to a pharmacy, and Ohio is one of the hardest hit states. We've seen several pharmacies close in our region, and our pharmacy desert population has grown by 410,000, meaning nearly 2 million Ohioans have limited pharmacy access or have to drive nearly an hour round trip to get to one. The state is keeping tabs on the worst hit areas. They authorized telepharmacies to expand access in rural areas, and House Bill 192 seeks to regulate pharmacy benefit managers to prevent practices that harm independent pharmacies. They're even working on ways to give pharmacists more prescribing power in areas where there are limited primary care doctors. But that is still a work in progress. I'm Monica Robbins, and that's your Daily Dose.